Welcome to the African American Focus Group Attitudes and Strategies Surrounding Flavored Tobacco webinar. This is a collaboration with the Center for Tobacco Policy and Organizing and AMPLIFY, the African American Statewide Coordinating Center. Before we begin, as a reminder, at the bottom of your screen, there are multiple application widgets you can use. All of the boxes are resizable and movable, so feel free to move them around to get the most out of your desktop space. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in the background that could cause issues. For the best audio quality, please make sure your computer speakers or headset are turned on and the volume is up so you can hear the presenters, and make sure the media player on your screen is enabled. If you have any technical difficulties during the webcast, please let us know via the Q&A box. If you have any questions during the webcast, you can submit them through the Q&A box. This webcast is being recorded and will be available tomorrow and can be accessed using the same link you used to register. And now we'll begin the webcast, and I'll turn it over to Karina to start us off.
All right, hello everyone. Thank you for participating in our webinar today. I'm Karina Camacho. I'm a policy specialist at the Center for Tobacco Policy and Organizing from the American Lung Association. I'll be starting off our presentation talking about some of our focus group's findings, and I'll pass it on to Carol and then Yalan, who will provide us more strategy and context for some of our findings. So the Center for Tobacco Policy and Organizing, we are a statewide tobacco technical assistance agency. We provide training and support for local tobacco campaigns in California, specifically organizing and policy. I focus a lot on the policy trainings. So we have the great pleasure of doing focus groups in California. We did 6 total focus groups dealing with flavored tobacco. Today we'll be talking about the focus group that we did with African American men and women in Oakland. In these presentations, we were able to show participants information about flavored tobacco products. We showed them actual products, as well as some of the messaging in favor of flavored tobacco restrictions, as well as some of the messaging from the tobacco industry against flavor restrictions, and ultimately facilitate a dialogue. The awesome thing is that we had a third party facilitate this conversation, and they were able to kind of just let people speak freely. We weren't trying to necessarily get them to agree or disagree with what was being said. We tried to make sure that these focus groups were closed off by ethnic group. A lot of times these issues are racially charged. There are some controversial topics, and I think we felt that it was better to have each racial group able to share their opinions freely and honestly. So yeah, we'll be able to talk about that today. The African American focus group had, I believe, about 8 participants, and it lasted about 90 minutes. So I won't be able to cover all of the 90 minutes of content, but we'll be able to cover a lot. So like I said, it was 90 minutes of content. We broke it down into 3 important themes that we felt that came out through the entire conversation, and it can really kind of guide the work that we're doing. So it was targeting the community impact of these policies, and then the overall messaging for tobacco control. So what I'm going to do is I'm going to bring up some of the quotes that best highlight kind of where the conversation was going. These quotes aren't the end-all be-all of the whole conversation, but I think highlight what was the overall sentiment of the group. First thing we'll talk about is the industry targeting. As I mentioned, we showed participants some of the tobacco messaging coming from the industry, and they were very familiar with this messaging. One of the women said, I remember seeing these ads in Jet magazine when I was a kid, and in Ebony magazine, I was having flashbacks. This was in regards to the ads, especially specifically menthol ads that she saw growing up. Another man said, this is brilliant marketing, but it's also targeting folks specifically. Again, because they know it is still a slave mentality, and the white folks that run these big companies, they know exactly how harmful this stuff is. They know their kids are probably not using this stuff, or grandkids, and it's just one more version of the attack on our people. That's all I got, but it is what it is. Again, participants were very aware of the marketing, and they were aware that the harm that it is causing toward their community. And we kind of dug more into those feelings, into how people felt, and ultimately it's very emotionally charged, and I think it's important to talk about that. One woman said how she felt about it. She said sad. There are so many underlying words, but overall it's just sad. We already know you all don't like us. That was actually from an African-American man. Another statement also from a gentleman was, I said disturbing, and I will now also say upset and not so much. We all didn't know that this is what is going on in terms of what tobacco is doing and how they're targeting kids and minorities. Something I highlighted is big tobacco loves vulnerable populations. It is. There you go, vulnerable. What do we do as people to stop being vulnerable? I think it goes back to some points that pretty much everyone has said it. At some point, we need to change our habits. We need to change how we raise our kids. And there was an overall conversation about this, about what the community can do around these issues. I think it's really important to acknowledge that everyone in the room was aware that there is targeting. There were some other focus groups where people necessarily weren't aware of that. We were showing them some of the targeting for their community, and they didn't believe it. But when it came to the African-American community, they were very aware, and they all were kind of on the same page, and sort of this is happening, and it's not okay. Next was the community impact. And as I mentioned, we were able to show participants different messaging, and that included some of the messaging from the tobacco industry and some of the arguments against flavored tobacco restrictions. And we were able to ask them, when it comes to flavored tobacco restrictions, do you see this argument as not compelling or very compelling? Our arguments that were rated a 10 were seen as very compelling. So when it came to the statement, law enforcement will use these restrictions and black markets as an excuse to unfairly target African-American communities that are already vulnerable to increased scrutiny and harassment, all the participants in the African-American focus group rated this a 10 as very compelling. Because it was a small group, you can't necessarily make assumptions about the entire population, but I think it's very important to note that the fact that every single person in the group gave this a 10. Again, we can't make quantitative assumptions, but I think that this is a really big issue. And again, if everyone said it's a 10, I think it's important for us to acknowledge that. And then going on into what people were talking about. And I think this woman really captures it well, where she says, I didn't interpret restrictions in a way where it became these laws and incarceration, but I think that should always be taken into account when you're dealing with black communities being affected by things. And what are the consequences? Again, she didn't necessarily see it in the view of incarceration, but once it was brought up, she mentioned you always kind of have to consider that when you're dealing with black communities. Another man stated they love putting black people in jail and emphasize the love. So again, there's a lot of sentiment there around these issues. Another woman said, my mind is wrapping it around this, and it is like so much damage has been done to the black community in efforts that are disguised as trying to help, actually creating more damage, and they're never really addressing the original damage that started. Again, there's a lot of layers to this issue, and I think it's important to address that even as we move forward in tobacco control, trying to bring help to the community, there sometimes are these unintended consequences, and we need to be aware of that and the different levels that we're working in our communities. All right. Next, I'll talk a little bit about the support for flavor policies. In addition to doing focus groups, the Center for Tobacco Policy and Organizing also did a statewide poll asking voters about tobacco retail policies. We had a few questions that had to deal with flavored restrictions, and I'll be talking about them. One thing I will say is that this survey was not necessarily targeted to get information about the different racial groups in California and how they felt about flavored tobacco. But after looking through the data, there were a few points that I thought are important to bring up. So again, what I'm saying is that the sample size is super small for my findings that I'm talking about right here, but I think there's a lot of important trends we can talk about. So with that being said, this is two of the questions we asked. So we were asking voters what they saw as good reasons to support flavored tobacco restrictions. And when it came to the question, a good reason to prohibit the sale of flavored tobacco is that it can reduce youth smoking. Again, our sample size is really small, but when you compare the different racial groups, we have that 91% of the black voters in this group felt that that was a good reason, compared to 70% of white voters and 78% of Latino voters. The reason I'm bringing this up, even though it's a very small sample, is because it was statistically significant. So when you compare black voters to white voters, this difference was statistically significant on a 95% confidence interval. So if we did this survey 100 times, 95 times you would get a difference between black voters and white voters. This is definitely outside the margin of error. There was a clear difference. And then when it came to Latino, it was also a difference. 91 to 78 was on a 90% confidence interval. So again, 90 times out of 100, you would see these big differences. And then when it came to the other question, a good reason to prohibit sales of individual little cigars and cigarillos is that they are developed and marketed primarily to African Americans and Latinos. So this law can help reduce smoking rates among these groups. Again, we saw statistical significance in the difference between black voters and white and Latino. Black voters voted this as a good reason with 83% compared to 60% white and 63% Latino. As I mentioned, there is a statistically significant difference on a 95% confidence interval. Like I said, small group when you think of the overall population in California, but it's kind of a trend. I think there's more meat here that we need to acknowledge. The reason I wanted to bring this up in comparison to the previous statements talking about incarceration and law enforcement is that while there are these concerns from black participants, there also is a lot of support for these policies. I think it's important to look at those in the same breath, in the same guise, is that you have these concerns but also a lot of support. And it's important to consider both of these as we move forward in tobacco control campaigns. Next was our messaging. As I stated, we were able to show participants marketing as well as just information from both the tobacco control side and the tobacco industry. And these are some of the comments they had about information from the tobacco control side. So there was information dealing with Save Black Lives, ban menthol cigarettes. A man stated, it is pandering and it doesn't respect all of other lives that we've lost in the things and we've been through. A woman stated, I had a long day and I've been taking care of a 2-year-old. I know I'm here to give my opinion. I like this lease. This was the one. It is time to save Black lives. I just really eye roll behind that because there's so much more other things that we need to focus on as people. Institutionalized racism. There's more to it than these damn cigarettes. A woman stated that. One thing I will say is that we did not tell people where this information was coming from in order to keep it unbiased and have them state on the content rather than who said it. And I think that that's important because a lot of participants did not believe that this was from an African American resource, and I'm not sure necessarily if that would have swayed them. We wanted to keep things unbiased and things like that. So next, we also asked participants to tell us who do they want to hear from when it comes to tobacco and public health messaging. And out of all of the other groups that we did the focus groups on, African American participants were the only ones who really wanted to hear from their ethnic group and their community. You'll see here they want to hear from parents. That was number one messenger stated. Next was Senator Harris, the NAACP, African American Tobacco Control Leadership Council. We also have California Black Health Network and faith leaders. And this woman really captures kind of the overall sentiment. I picked the California Black Health Network and the African American Tobacco Control Leadership Council. I'm looking for black-focused things that cover health and tobacco to put forth. And as I mentioned, when we originally showed them the information from the tobacco control side, we didn't tell them who it was from. But after kind of hearing who they wanted to hear from, I'm sure that probably would have impacted them. And it's kind of important to make sure that we keep this in mind when we're thinking about who is relating tobacco control messages to African American community members. Yeah. So that is my section in terms of the findings. I'm more than happy to answer questions related to the findings. I can answer them in the Q&A section, and then we'll take them at the end of the presentation. I can also discuss things after this webinar. So with that, I will pass it on to Carol.
All righty. Thank you. Thank you, Karina. And I just really want to thank you, Karina, and the Center for doing this focus group. It's very important, and it really aligns with the work that we've been doing. And I just want to highlight some of my reflections and comments on the results of this focus group. So I'm Carol Magruder. I'm the co-chair of the African American Tobacco Control Leadership Council. I should say the proud co-chair. This is us here. We were formed in 2008, and we educate our community and our stakeholders and public health officials about tobacco control as they affect the lives of African Americans and African immigrant populations. And we're proud that from our beginning we have had our African brothers and sisters with us who are immigrants to this country, because we are all Black folks here and we're all in the same pot in many ways. So I have these reflections that I have, and I also have broken them down into different categories. And so we're going to talk about the messengers, framing, legitimate concerns of the African American community, which often can override our need for good public health policy because of, the legitimate concerns that we have, and I'll discuss that in more detail when we get to that section. Being solution-oriented and building capacity in our community. So that's how I've broken up my presentation. And I want to start with the messengers. So many of the messages that we are delivering, I call them family conversations, and I think this is probably true for many priority populations in California. They are conversations that only we can have with each other, and that outsiders coming in are seen as people who don't know what they're talking about, who don't understand our communities. And sometimes people might say that about us as well. But when you're having that family conversation, it can eliminate a lot of the noise that you might have when you're trying to talk about some of these sensitive topics. And then I want to talk about proxies. Karina mentioned that Black folks really talked about that they want to hear these messages from people in our community. And proxies are people or entities that speak for the whole or speak for another person. And they're important to everybody, but they're really important to the Black community. And when I think about why, I think about, there was a time when it was illegal for Black people to read in this country, and that there were groups of us who represented all of us, who were our learned people, who were the educators, who were that top 10% that guide the group, and we still have those relationships today. And so the proxy groups are our leadership groups, so that would be the NAACP was mentioned, our sororities and fraternities, our Black newspapers and our Black media. The first Black newspaper in this country was called Freedom's Journal, and it was about getting freedom for people. In the early days when we started having so many Black newspaper publications, it was estimated that a Black newspaper touched 40 hands before it was thrown away because it was passed around as a source of information for the community. So even though our Black newspapers now, there's less of a readership, but the circulation and the readership of people who do read those papers, those are the people who are informed, those are the people who work on policy, who vote, and who shape the opinions of other people in their sphere. So our media is very important, respected elected officials, and religious institutions. So those are important messengers for our community, and those are the groups that we have really tried to bring on board and to work with. And they also are a prime weapon of the tobacco industry, because the tobacco industry understood this phenomenon long before we did, and they cultivated and used our leaders and institutions against us to blunt public health policy. So as I said, there's the AATCLC celebrating our 10-year anniversary. We've been instrumental in the conversation and the work around this country to prohibit the sale of menthol and flavored tobacco products. And that wonderful picture there at the bottom is myself and Dr. Valerie Yerger the night when San Francisco voters, a city that has only about 5% African American population, they voted 70% to uphold the citywide restriction on menthol and flavored tobacco in that city, and we were very proud of that day. The Delta Sigma Theta sorority, one of our strongest and boldest African American professional organizations, they were the first national organization to pass a resolution in 2013 that supported getting menthol off the market. At that time, we were really trying to work with the FDA. Still had hope that something would happen before the local jurisdiction started taking this on. So when you go into a room of professional Black folks and you say the Deltas did it, it gets their attention. And it opens their mind to think, because the Deltas are a proxy of an organization that is about the good of our community. The Bay Area Black Nurses Association had a resolution. Nurses, as we know, have strong credibility across all groups and are important. And then the NAACP, our National Association for the Advancement of Colored People, adopted a national resolution calling on local branches to support state and local efforts to regulate menthol and other flavored tobacco products. So this was a resolution that was really also 10 years in the making. We were very proud of this, and local branches have started coming on board and supporting our local efforts to prohibit the sale of menthol flavors. So we know that from this article, our seminal African American leadership group, Smoking with the Enemy, this research article journal was written almost 20 years ago, I think 18 years ago, and it's getting more use than ever. And so we know that the classic tobacco industry playbook is that they get organizations to act as a front for them. And so one of the groups we were sad to say is the National Action Network, a group that is led by Reverend Al Sharpton out of New York, who's a famous civil rights leader and has done a lot of work in our community. So these were these town forums that were going all over the country talking about the unintended consequences. Karina mentioned the fear that African Americans have that even when we're trying to enact something that's good and positive for our community, it will be used against us, as historically many things have been. So this is a real fear, a legitimate fear and concern that we must address in our work as we go forward. So the RAI there is Reynolds American, who are big stakeholders in Newport Cigarettes. This is Reverend Al Sharpton at a church in Oakland, California, and he wasn't saying that he was against restricting menthol. He was saying that we need to ask the question. We need to talk about it. And I agree with him. We do need to ask the question. We do need to talk about it, but we just don't need to talk about it on the dime of the makers of Newport cigarettes. That was my disagreement. These were some other gentlemen. And so when we're talking with our people, usually when you're presenting an argument or presenting facts, they say don't mention what the other side says. But I disagree in this instance. When we're talking with African Americans, we need to address these issues up front, head on, because no matter how straightforward what we're saying sounds, we still have to, we're going against the history of police brutality, of officer-involved shootings. And so people will, even though they agree with you, they'll think that, bad things are going to happen, which many bad things have happened. So we need to address these things head on. This was also at the church, and this is a picture that Dr. Valerie Yerger arranged to get. And this really gets African Americans mad because this gentleman was an executive from Newport Cigarettes, and he was sitting in the back of the church when there was a lot of going on, a conversation about this at this town hall meeting that was sponsored by the tobacco industry, and he was taking it all in. So this is an example of something I can show in a community forum for African Americans that really gets them hot because we're dying and we're having all this going on, and he's sitting back taking notes on our misery. Trying to get this to go back. I went back too far. So yeah, so this is part of that ongoing engagement and keeping people current about what's happening. And it's very powerful, and it gets people really angry and engaged, and they want to do something about the #1 killer of black folks. This is also something that we love to show, is that our black elected officials are taking the lead. This is San Francisco Supervisor Malia Cohen at the press conference when she introduced the first citywide menthol sales ban. In the middle there it was Mayor Ed Lee, the first Chinese-American mayor of San Francisco who passed a little bit after this happened, but that was one of the last bills that he signed into law in San Francisco. And this is a picture that we need to show of the police chief of San Francisco in between the vice mayor of Oakland and Supervisor Malia Cohen, saying that we're on the same page. I had a chance to go down and meet with the police chief in Santa Clara, the city of Santa Clara, to talk about, that we do not want punitive measures around these laws that as we're rolling them out. It's about the retailer. It's not about the individual. It's not about, as we raise the age to 21, for example, for tobacco, we do not want penalties for people who have cigarettes who are smoking who are under 21. The penalty is for the person who's furnishing the product, who's selling the product. And this is important because the industry uses that against us to scare our community to not enact, so that they will not enact strong public policy. This is a manifestation of our 2016 NAACP resolution. This is Dr. Jonathan Butler, who is representing UCSF and the NAACP, the San Francisco branch, at that press conference that we had that was so powerful. So when our people see the proxies for our community, the NAACP, the deltas, respected officials and leaders, it makes them willing to get over the fear that we have, a legitimate fear about the unintended consequences of things. So we've talked about messengers. I want to spend a little bit of time talking about framing. So when we're framing it, we have to keep things in perspective. We have to have fierce honesty, the family conversation again. We have to make things relevant for our community, and we have to show the big picture. So in that framing, this is a slide that I had retired and pulled back out, and it's just talking about the priorities and issues that African Americans face and comparing them to the issues of developing African countries, that we have many of the same issues. But in spite of that, in spite of economic development, racism, oppression, police brutality, chronic stress, and we're talking more and more about the harm that stress has, chronic stress has, we still have to deal with that tobacco kills more than all of these other things combined. This is a powerful graph that I show so that people can see that in a picture, that the tobacco deaths for African Americans is $45,000 compared to homicides, which is around 8,600, and even AIDS is much lower than that. So that when we're prioritizing and framing our issues, of course, we have to put the thing that's killing the most of us by a landslide, we have to put that in our top 5 priorities, so that while we're dealing with the other issues, we have to deal with tobacco control simultaneously. So that's part of that framing. In framing the issues, there's talk that people who don't know the history of the Tobacco Control Act, and that in 2009 they took out all the flavors but menthol. They feel that, they're trying to take menthol away from black folks. It's something that we want, and other people have what they want. So we have to point out that when this act was passed 10 years ago, all the other flavors were taken out except for menthol. This act was meant to protect children, but it did not protect black children. At the time, Joseph Califano said that not including menthol in the ban and the flavors ban was relegating black children to the back of the public health bus. These are the children who are not protected, our beautiful Head Start babies, many of whom are exposed to secondhand smoke at higher levels than other groups. So these are the children that, leaving menthol in, these are the children that were left out. And that we have trickle-down public health policy. And we know trickle-down economics doesn't work, and neither does public health policies. This is another article written by my sister colleagues, Dr. Valerie Yerger and Ruth Malone, just talking about the racialized geography and the corporate, the predatory practices that were used, and why African Americans smoke so much menthol. So this is an abstract that we actually submitted for the World Conference on Tobacco or Health in Singapore, and it was entitled The Least of These, U.S. Tobacco Control Policy, Mentholated Cigarettes and African Americans. So this was before Chicago came on board, and we actually started becoming successful at getting municipalities to adopt policies that prohibit the sale of these products. And this is our poster girl for the sale of these products, the giveaway. This is Marie Evans, who was given Newport cigarettes at the age of 9 in Boston in public housing. And this was a practice that was common in all the major cities in this country. She was addicted at 13, dead at 54. And her family did sue, and they were settled for $79 million. So when we talk about the value of a life, this is something that has great import for all of the African Americans who have been affected by this pernicious targeting of our communities. So these are just conversations that we need to have as we're engaging our community and getting them on board with what they're doing. We want to always remember that chemistry and access equals addiction, as we're seeing with the opioid epidemic in our country right now. It's not that one particular race is more susceptible to addiction than others. It's about the circumstances. It's about the community norms that expose people to these addictive products. and that have, these elevated use for, in this case, menthol cigarettes. So we want to always frame menthol as a social injustice issue. I was tickled because this is an old, this was used 20 or some odd years ago, and we've upgraded a little bit the graphics, but we want to frame it as a social injustice issue. And then I also wanted to comment when there was someone in the focus groups who said it was pandering or that we have other issues, that damn cigarettes aren't the only one. So when we're framing the issue correctly, people do understand, and it does cause a shift in their consciousness and elevates this as a priority. We also talk about the end game. California Department of Public Health, we have declared that by 2035, we will end this thing and that we will have zero smoking prevalence. And so we want, when we show this to our people, we don't want to be left out of that. And so when we get to that finish line there in 2035, we don't want African Americans or people, LGBTQ, or other party populations to be lagging behind and still having a high smoking prevalence. We want all Californians and the rest of the world. We have a lot of folks from around the country on this webinar. This is, spreading out all over this country, and we are happy to see that happening. So I also want to spend a little time just talking about those legitimate concerns that need to be addressed. And so this is Eric Gardner, who's used as kind of the poster boy for tobacco control laws gone wrong. I backed up too far. So this, our detractors say that because the cigarette taxes were so high in New York, this brother was selling loose cigarettes in New York, and that contributed to him being choked to death there. And this was part of the Black Lives Matter that sprung up was this man's death, Eric Gardner. And so in my presentations, unfortunately, I say, it wasn't the cigarettes. It was the changes that we have to make in our society around policing. And that shortly after this, there was a brother who was killed in Baton Rouge, Louisiana, for selling CDs and DVDs. So it's not the cigarettes that should stop us from enacting strong public policy. This man is Uncle Bobby, and he's the uncle of Oscar Grant out of California, who was killed. These are just some photos. So these are the boys. This is Baltimore, the uprising. This boy is probably 12 years old with a cigarette in his mouth. So we take on Trayvon, Oscar, Jordan. We put those up front in our presentations that we know we have these issues, and we combine the issues around tobacco control into the other issues that we're facing. We're not doing this in a vacuum. This is Jordan. This is the boy there with his father there. The police officer shot into the car as they were driving away and killed this boy. So we get with our community. It's our pain as well, and we address it head on. And that's very important because people are legitimately fearful. We make the point that the biggest predators, the super predators, are tobacco industry executives. This is a photo of them in 1994 when they lied to Congress that nicotine was not addictive compared to the Sopranos. And so they are federally adjudicated racketeers under RICO. Racketeering influence corrupt organizations. And when we associate ourselves with them, that's who we are associating ourselves with, our gangsters with suits on. And so we want to be solution-oriented. We hear all the bad, and this is the thing in focus groups. We hear enough bad, and so we're making an intentional shift to embrace the positive and amplify the good. Yolande Burrs is going to come and talk about that. But we want to be solution-oriented as we address the issues. We want to start this by starting with ourselves. This is a wonderful book that I have not read yet, but I've listened to the interviews by Dr. Jennifer Eberhardt. She's a psychologist out of Stanford there, and the book is called Biased. And so everyone has biases, and this is a link to her interview with Trevor Noah on The Daily Show, which is a wonderful interview. I encourage all of us to read this book because in our field, it just helps you to get in touch with your biases and to check yourself. We all have to check ourselves, and we have to let our communities know that the concerns that we have are real, we see them, and that we're all working on them. It's not a black issue, these issues. It's an issue for all of us to work on, and it makes our work easier when people feel that everyone is concerned and that everyone is working on this. So the first thing is to look at our own biases and to address the issues and to include bigger picture issues in our work. So we want to deal with social determinants of health. We want to deal with equity. We want to create opportunities as we're moving. I liken sometimes public health is like the criminal justice system. In the criminal justice system, there are a lot of brown and black defendants, and in public health, there are a lot of brown and black patients. And so we want to change that dynamic, and we need everyone on board working and being employed in the solutions to these issues. And so we want to create opportunities. This slide is a slide from a community capacity building project in San Francisco over 20 years ago. These young men were teenagers working at the Booker T. Washington Center. They had a community action model grant, and they worked on BD, something that most adults I'd never heard of at the time, but they actually impacted national legislation around BDs, which these were little cigarettes that were being imported from India. So we want to build capacity as we go. The California Tobacco Control Program, they're rolling out new mechanisms to rebuild the tobacco control infrastructure for our priority populations. And with that, I'm going to pass it on to Yolande Bird. So this was what public health used to be, and this is what we're having right now. It's a tsunami, a good tsunami of good public health policies. We're dancing as fast as we can. These are my main colleagues from the council. We're working on this issue nationally, Dr. Philip Gardner and Dr. Valerie Yerger. And Dr. Phil says, sometimes you get what you ask for. So we've been asking for this. We've got it. We're very excited, and we intend to move this agenda forward as we're moving forward. So with that, I'm going to pass it over to Yolande, who's the project coordinator with AMPLIFY.
Thank you, Carol. Once again, my name is Yolande. I'm AMPLIFY's project coordinator. The California Tobacco Control Program has funded AMPLIFY to work to rebuild and increase capacity of African American and African immigrant communities. We're conducting meaningful and relevant tobacco control programs and activities. AMPLIFY is the African American Statewide Coordinating Center, where we provide culturally relevant expert support and tailored assistance to tobacco control programs, non-traditional partners, and the greater community. Our mission is to work collectively in love, unity, and cultural humility to educate, empower, and engage our communities to end commercial tobacco use, all the while fostering a legacy of physical, mental, and spiritual wellness. Karina has presented interesting findings about the opinions of African Americans regarding tobacco, and Carol has discussed how we translate these beliefs and attitudes. I'll be discussing practical options to engage our community based upon these findings. I'm going to take a moment to highlight the services that we provide to our regional grantees, whom we refer to as partners, and services that may be of interest to local lead agencies and non-traditional partners. We assist with navigating the world of tobacco control by supporting organizations to understand challenges and offer the best solutions. We're experts in tailoring assistance to your needs and look forward to helping organizations reach our community, collaborate on events, and provide resources. Moral support is essential. Some of our partners are brand new to tobacco control. We have an all-in-the-together approach and a we will prevail determination as we assist them with their program objectives. As you know, our community is disproportionately affected by the tobacco industry's targeting of Black communities, and we help our partners combat the tobacco industry through meaningful community engagement and outreach. We collaborate with LLAs and the greater community to build the capacity, strength, ability, and resiliency of our neighborhoods, conquer the many issues that we're facing. We're working to help our community take better care of our children, our elders, and ourselves. We believe that strong, healthy people build strong, healthy organizations and communities. AMPA Leadership Development Program aims to build leaders as we educate our people and help them gain access to the many career opportunities in the fields of public health, tobacco control, media, research, evaluation, and much more. We have programs for students and young adults and seasoned professionals as well. Our program duration is 4 months, and our first cohort begins in June. Now, AMPLIFY knows that as we rid our communities of deadly addictive tobacco and nicotine products, our people will need help quitting smoking and vaping. We don't want them to feel like they're alone, so we've created an email address. You can stop at amplify.love where we work with our community to provide tailored cessation resources. Our trainings, workshops, and webinars cover a wide variety of topics, all with the aim of engaging and educating our community. We believe in the importance of collaborating with community partners to mutually support each other. 5 statewide regional grantees have been funded by the California Tobacco Control Program to conduct this invaluable work in our communities. They work collectively to empower our communities to advocate for change, and these organizations are also available within your regions to collaborate with you regarding your local tobacco control efforts. In Tri-County South, we have Riverside County Black Chamber of Commerce. The San Diego region, Nile Sisters Development Initiative. In Central Valley, we're partnering with YLI, Youth Leadership Institute. For Los Angeles, we're working with the African Communities Public Health Coalition. And in Gold Country, Saving Our Legacy, SOUL Project. Our partners will be working with our communities on menthol and flavored tobacco policies, multi-unit housing policy. They'll be establishing youth engagement tobacco control programs and work with faith-based organizations to implement smoke-free policies. To be most effective, we aim to focus on each generation within our community through strategic community engagement and social justice-centered education. One focus group participant was quoted saying, "I just really eye roll behind that because there's so many other things that we need to focus on as a people. Institutionalized racism, there is more to it than these blank cigarettes." Now this focus group participant's candor is expressing that tobacco is not a top priority, but it's a clear example of why educating and informing our community about the pernicious targeting of the Black throughout the decades is a cross-sectional social justice issue. Now, studies have also shown that 91% of African American voters believe a good reason to prohibit the sale of flavored tobacco is that it can reduce youth smoking. The question then arises, how do we engage our community subgroups, and which community education activities have been effective? And what innovations can we use to engage millennials and Gen Z? Faith-based engagement approaches have been effective in educating pastoral leadership. They have a large influence within the congregation and communities. Community health fairs are often co-sponsored by the church, and the popular No Menthol Sunday in May educates large congregations annually about the health effects of tobacco and other cessation resources. California Black Health Network town halls are customized community symposiums for African Americans that have successfully empowered our communities to take action. Innovative community engagement strategies that could be implemented to connect with millennials and Gen Z can include spoken word contests at neighborhood cafes. You may be familiar with the poet Six Footer, who opened at the CTCV Project Directors meeting last fall. She was the first winner of AATCLC's No Menthol Spoken Word contest a few years back. Hip-hop culture is cross-generational and engages youth, tying in social justice issues within hip-hop culture to tobacco injustice. Through youth engagement activities, this is another approach. Alternative approaches to reaching African American men can be done through barbershops. Barbershop Chronicles has offered tobacco education days within urban neighborhoods. City events and special holidays such as Black History Month and Juneteenth, June 19th, the day African American slaves were told they were free, are great opportunities for advocacy, recruitment, and education. In closing, we believe that amplifying our voices within our community will foster a movement against big tobacco that will educate, empower, and engage. Please feel free to contact Carol or myself if you have questions or you're interested in our services. Karina, back to you.
Awesome. And again, thank you again to Ilana and Carol for all the awesome information you all presented. We'll take it over to questions. We'll have Whitney, our moderator, ask questions, and then we'll be able to answer them.
Wonderful. Thank you so much. And our first question comes, what was the age group or groups of participants in your focus group?
Yeah. In the focus groups, we had it wasn't based on any age group. It was all adults. We had people in their early or kind of maybe mid to late 20s, as well as older adults past their 60s. So it was a wide range.
Perfect. The next question will be sort of a multi-part question. What was the sample size? Where can we get the results of this poll to show lawmakers? Was there a question specifically about menthol? And did they come up with the messenger list on their own, or were they given a list to choose from?
Okay, awesome, and thank you to the person who asked all these questions. So the sample size for the tobacco retail poll was 577. 31 were Black, 119 were Latino, 34 were Asian, and 314 were white. As I mentioned when I was making the comparisons on racial groups, the sample sizes are very small for the racial groups. I just kind of wanted to look at the statistical significance about that. We didn't have any specific question about menthol related to this. We used a generic poll that just dealt with flavored tobacco. And then I think the other question is where are these polls available? They are available on the website for the Center for Tobacco Policy. Let me pull up the link. It's on one of our slides. Give me a second. And then in terms of the focus groups, when we asked about messengers, we provided them a list of messengers. And they were able to select from there. And we gave them messengers such as the American Lung Association, Center for Disease Control, as well as local groups in their area in Oakland, and as you saw, as well as ethnic leaders as well. And as I mentioned, you can find the results for the tobacco retail licensing poll on the Center for Tobacco Policy.org. It would be under Tobacco Policy. You go to Tobacco Retail Environment, and at the bottom we have a bunch of clickable links. It's the Tobacco Retail Licensing California Voters 2018. You're able to see the actual results as well as documents summarizing the data. I'm more than happy to go more in depth on these polls. I can be contacted via email for anything related to that.
Great. Our next question. Why do you think the poll showed such a low number of Latinos that felt legislation would reduce tobacco consumption rates?
Yeah, so that's a great question. Actually, it's a lot more nuanced, and we did a whole webinar about that. This webinar with the African American Statewide Coordinating Center is part of a 3-part series. We did a webinar with the Hispanic Latino Coordinating Center at the beginning of the month, and we're able to go more in depth on that finding. So it's actually a little bit more nuanced. I'm happy to send out the link to that webinar as well. It already passed, but there is a recording where we go into those findings. We're also going to have another webinar on LGBTQ related to that. So thanks for the question.
Great. We also have a few questions coming in asking if the PowerPoint will be available after the webinar.
Yeah, the webinar will be available via the same link that you all registered. You can access it in 24 hours. You'll be able to see the webinar all over again.
Wonderful. Our next question. If you already mentioned it, please repeat where you are getting the data on deaths in the African American tobacco versus et cetera. And I believe this may have been later on in the presentation.
I think this was a relation to the slide up. I think it was talking about tobacco deaths and homicides versus AIDS. I think, Carol, you might have brought this up.
And Carol, just to double check the mute feature on your phone.
Hello, can you hear me now?
Yes, we can.
Okay, great. So there are some citations on this slide, and what I'd like is if the person can send me their email, I will send it out to them because I can't read the citations that I have for those statistics.
Okay, wonderful. And our next question. Is it possible to get no menthol Sunday materials?
Is it possible to get what?
No menthol Sunday materials.
Yes, it is. So if people go to NAPTN, we are a proud affiliate of NAPTN. NAPTN, their website is NAATPN.org. There's a tab for No Menthol Sunday, and there's all kinds of wonderful information. If you are in California, we are going to be ordering some fans for the churches, so if you would like some fans, if you could drop myself or Yolande Burris an email, and we will get you some of the fans, the church fans. So naptin.org, NAAPTN.org, and there's all the information there for No Menthol Sunday.
Wonderful.
And you can also contact us directly as well.
Great. So we'll take our next question. How did you recruit focus group participants?
So for focus group participants, again, we worked with a third-party agency that does focus groups, and we just asked them to look for African-American adults in the Oakland area, and they have a list of, I believe it's voters that they reach out to, and they offer some type of gift card for attending. We did filter out to make sure that we didn't have too many experts in the room or perceived experts. We didn't allow for more than one cashier or any health physicians. That's kind of how we picked people. I'm happy to connect you with the organization or the company that did our focus groups to get more information about that. So you can always shoot me an email if you have a question.
And this is Carol. I had the wonderful opportunity to sit in on behind the glass on a focus group that Tobacco Free Kids did in Newark, New Jersey. This is about 2 years ago. And it pretty much the opinions jive with what we're seeing today with the center. In Newark, the group was just such a diverse group of African American smokers and all different kinds of folks. And they all were supportive of restrictions and policy legislation, but they were all afraid of police. And so, Newark and New York are ground zero for the stop and frisk activities that the police did for decades there. And so that was a huge concern, and that was echoed here in Oakland as well. But they were all supportive of getting these products away from our people, out of the community.
Great. And we do have a follow-up from Michael with NAATPN. He is wanting to let you all know that they are out of fans, but like Carol said, the AATCLC will have some fans available. So just a follow-up note. And we'll take our next question. Does anyone have resources that prove flavor bans reduce use, or uptake?
I know for the center, I don't have any specific research. I can look that up and get back to the person who asked that question and get back on some research. I don't know if Carol, if you have any research that
sure.
You can
I'm not sure right now because it's so new that we can't. So Chicago was the first city that came on board, and they did the buffer zones of restricting the sale within 500 feet of schools, menthol in all flavors, and the rest of the country was able to get under the broad shoulders of Chicago. I call them the White Wings. And so I know that researchers are looking at the effects that it has on consumption and on smoking prevalence. But since we're just now really getting started, some of that information will be forthcoming as things, as it rolls out in implementation. There have been implementation issues about the products, what is menthol. They changed the UPC code, so it's teasing all that out. But we're all watching it, and I know the researchers are on it, and we will be getting information as it becomes available.
Great. And we'll take our next question. Have there been any discussion about raising taxes on OTP, and if so, were there any feedback from the Black community?
So the OTP are other tobacco products. I know that there's been lots of discussion because the other tobacco products, which are the blunt wrappers, the Black and Mouse, the Swisher Sweets, the cheap cigars, there's lots of conversation about it, and there's lots of push to get those items, packaging sizes, taxes raised. So I'm not sure, it's a lot of different municipalities working on different things, but it is on our agenda to deal with those products as well, because a lot of those products were left out of the Tobacco Control Act as well. They still have flavors, they still have menthol, and they're cheap and they're available for black and brown people to use in their communities.
Wonderful. Well, we do have another participant asking if we could please supply the correct AMPLIFY website once more. They just tried one and believe they may have mistyped it, so if we could display that on the screen, the correct AMPLIFY website.
Yolanda, you want to take that one? Yolanda?
Sure, I'll send it now.
So it's amplify.love, L-O-V-E, and it's a new ending for the Internet, so that's not a mistake. And if you don't type in www.amplify.love, it does not come up. I found as well. It's new. It's a new website. So we're going to get the search engine optimization going so that it pops up right away.
Great. Thank you so much. And we'll take our next question. How do you respond to what some say that restricting or banning menthol is about further regulating African Americans?
Repeat that again.
Certainly. How do you respond to what some say that restricting or banning menthol is about further regulating African Americans?
So this is Carol, I addressed this in my presentation and that's something that you'll hear from people who don't know the whole history, that when the other flavors were taken out in 2009, menthol was left in. So at that point, we were not protected. We were not given the same public health protections as other communities. The flavors were taken out because it was widely recognized that flavors increased uptake of smoking in children and youth, that menthol makes the poison go down easier, as Dr. Phil says, and that it was left in the first place. That was the error, that was the oversight, that was leaving us out without protection. And so now we are trying to clean that up and give African Americans, and African Americans are not the only people that smoke mentholated products. Women do, Native Hawaiian, Pacific Islanders, Filipinos. There are other groups, but it's just that 80 to 90% of African Americans who smoke menthol because of the pernicious targeting. So that's a flavor that needs to be taken off just like the other flavors were. And we also need to give people the support that they need to get off of these addictive products. And AMPLIFY is all about that, as is the African American Tobacco Control Leadership Council. We can do something better. We can stop smoking. We absolutely can, and we will.
Wonderful. And we'll take our next question. Can we revisit the comparison of African Americans to Africans in developing countries? We would like to see the overlapping issues once more.
Okay.
Okay, awesome. And I'd actually like to go back. I think someone was able, in the Q&A, was able to provide us the number on teen tobacco use. So out of New York, teen tobacco use was down by 28% after flavored tobacco policy was adopted, and that's from Farley Johns, Tobacco Control 2016. So thank you for whoever provided that stat.
Thank you.
And then I believe Carol also mentioned the Chicago study. And for those of you in California, someone has let us know that that Chicago study is available on Rover, and we're more than happy to send it out to the person who asked that question.
Great, thank you so much. And we also have the citation for deaths, tobacco deaths versus deaths from other causes, and that is listed as a source of actual causes of death in the United States, years 2000, authors Mokdad, Marks, Stroop, and Gerberding. And I believe that is all the questions we have at this time.
All right, so we'll give another minute or two for any final questions. If not, then we'll wrap this up. We'll give another minute. Great. Well, thank you to all those who participated in the webinar. Like I mentioned, that this is a 3-part webinar series. We did a webinar looking at Latino focus group findings, and next week on Thursday we will be doing another one talking about the LGBT community and their focus groups, as well as findings and strategies. Yeah, the registration link is right there. I can also take any email if someone wants to ask more questions.
Okay, well, thank you, the Center, for putting this together. And thank you, everybody, for tuning in.
Yeah, thank you all. This is a great collaboration. Thank you to Carol and Yolanda on all the great information you all provided. Again, thank you to everyone for participating, and we're more than happy to answer any questions offline.
Thank you all.
And this concludes today's conference call. You may now disconnect.